it's great to be here today with our audience. We have a very nice sized audience joining us today. This is one of our series of community relations events that we have been hosting. We previously did a Western New York, Buffalo area, a Syracuse, a New York City, a Long Island event, and this now brings us to Rochester. And next week, I, along with my downstate counterpart, Anna Almanzar, will be hosting a combined Capital District Hudson Valley event. So please, if you haven't already registered for that and you might be interested, go to our website, cabrinihealth.org, and sign up for that. So I'm going to remind everyone, use Q&A. We'll, all of us on the panelists will be able to monitor Q&A. And so use that and we'll get to as many questions as we can. And I'll just bring my three guests in now in no particular order, but why don't I start with Sharita? Come on in and introduce yourself, and then we'll introduce the others and get back to talking about you and your organization. Hi, Sharita.
Hi, good morning or afternoon now, Rick. Thank you so much for having me. The Healthy Baby Network has, we're actually celebrating 25 years this year of service to the Rochester community. And we've always been focused on reducing infant mortality and improving the health and birth outcomes of women, most especially those who are either medically or socially vulnerable. And so we have an impressive set of programs that include funding from the Mother Cabrini Health Foundation to place outreach workers out in our community every day looking for people who are not connected to services and are in need of support and care. We have health workers, community health workers who are working with parents, mothers and fathers during pregnancy, during birth and delivery, and then also in the postpartum period around their health and birth outcomes and helping them to access other supports that they might need in the community. And then we wrap around our other services at the agency, which include getting access to things like housing and really addressing some of those social determinants of health. I myself have been here 24 of the 25 years and have really just been excited to do this work and to be engaged with you all.
Well, thanks, Sharita. We'll come back to you for discussion and questions, but I now want to bring in Angelica Perez Delgado to say hello. And Angelica, why don't you come in and introduce yourself? Tell us a little bit about the Ibero-American Action League.
Yes. Hello, everyone. Good afternoon. My name is Angelica Perez Delgado, and I'm the CEO of Ibero-American Action League. Ibero has been in the Monroe County community for now almost 53 years. We have a long history in developing and growing and advancing the local Latino community, and we do that through a lot of different services. We go from babies to seniors to business development to housing, and we are blessed to be the recipients of a Mother Cabrini grant that has really helped us advance during the pandemic and be able to serve our community better. So Ibero also has a presence in the capital region and a small presence in Buffalo and Geneva, but the majority of our services are here rooted and started in Monroe County.
Thank you, Angelica. That's I have some questions that I'll get back to you on, but let's bring in Carla Palumbo from the Legal Aid Society. Hi, Carla.
Hi, Rick. Hi, everybody. Thank you so much for doing this. This is a great opportunity to talk a little bit about the Mother Cabrini Fund and about the work that we all do. I'm the president and CEO of the Legal Aid Society of Rochester. I've been in this role since 2014, but I've been at the Legal Aid Society this year. I celebrated my 37th year. I'm almost as old as the agency, which this year celebrates its 100th anniversary. We actually were created in 1893 by the Women's Educational and Industrial Fund that was started by Susan B. Anthony, and became incorporated in 1921. Our first funder was the United Way, and we were part-time, run by women, for women, and we've only grown from there. We provide legal services to medium and low-income members of the community in a variety of areas. We focus on civil legal services in housing, family law, immigration, education, and we're the mandated attorneys for the children in Monroe County Family Court.
Well, thank you, Carla, for doing such important work. And I want to get back to you a little later and talk about the interesting connection between legal services and social determinants of health. But I want to say this. Shannon mentioned my roots in the Rochester area. And for a little bit of background about me, and I smile when I think of Rochester. For those of you that tuned into the Syracuse event that I did in July, you'll probably remember I was born in Syracuse, but at age 5, my family moved to the Rochester area. My dad got a job at Xerox, and it was part of that big wave of Kodak was huge and Xerox was exploding in size. And so we moved to Fairport, and my mom still lives in the same home that I was raised in. And in fact, I was just back there painting the back steps this weekend. So it's I still get back quite often. And growing up in Fairport, I didn't think of it as unique in any way. It was a great school district and a safe environment. And I had an economically supportive and stable family that was able to support me even through college and law school. So it wasn't until sort of maturity that I really began to understand that a lot of people, and maybe even this is most people, aren't raised in that same protective and supportive environment. And it all starts before birth, right, Sharita? And so I want you to talk a little bit about the importance of prenatal care and education, healthy birth results, and the footing that gives kids in today's world. Oh, you're on mute.
Thank you. I remember starting at the agency in the 90s, and our push then was really to get moms into prenatal care, because we thought, and it was commonly believed, that if you could get moms into prenatal care early, that anything that was going on with them could be identified, could be treated, we could alter the outcome and have a healthy pregnancy and a healthy birth. And what we learned in continuing to do that work is that oftentimes pregnancy was too late. That, because we often found out that we were pregnant late in that first trimester, that anything that was happening in our body that was going to impact the outcome of our pregnancy was already at play. Damage had already begun. And so that really, if we wanted to have the maximum impact to improve pregnancy and birth outcomes, that we really needed to start preconception. And we really needed to be focused on what our health status is, understanding what is going on within our bodies, understanding our family health history, and also understanding all of those same things about our partners. And that with all of that information, partnered with a provider who was engaged with us, who was able to hear and understand our concerns, answer questions, that really all things began to be possible in terms of health and birth outcomes. And so as work has gone on, we really have learned and discovered that the social determinants of health and our racial health and birth disparities really are impacting those outcomes. And so if we believe that with, a healthy baby born to parents who are ready and prepared for that baby into a nurturing home, that everything is possible. We start with that hope and work from preconception to provide all the supports that we can for parents and for families. And so what we have really done is, in our work, we've also focused on working with teens and with youth around just being healthy and around understanding why it's important to have things like healthy relationships. We talked a lot about their person. And so, for those of you who, watch some of those TV shows where they talk about who's your person, and your person is the person that you go to when things begin to go either awry for you, or when you have questions that you just want to ask and not be worried about fear or judgment, and really trying to work to identify what resources and assets do you already have at play in your life. And so taking that same work, we meet so many of our parents that we do the most of our work with now when they are in crisis, when something is already not going well for them and they're pregnant. And so we began right with raising those assets. Who are your people? Who else can be involved in your life and in your health, your pursuit of health, that can help support you? And so, and working with whomever that person is, sometimes it's a partner, sometimes it's another family member, but working to engage that parents' people in their care, and being sure that people are as healthy as possible and providing those services, but also sort of stepping back and working with our partners to talk about what is our community contribution to the social determinants of health. How are we partnering with the other people who are providing services around things like housing? How are we partnering with other people who are providing other case management services? And when we have issues around substance use or other things that are going on, how are we partnered with the people who are providing those services, so that when it's needed, we have the ability to expedite care and provide service and support, and then ensuring that those handoffs are really, really smooth, because one of the things that we know is that vulnerable families can sometimes be caught in gaps between systems, and sometimes are sort of lost, and I'm doing air quotes, between our systems for things like paperwork processing or being able to get a certain piece of documentation. So really working to address all of those things.
One of the great things about my job is getting to meet and talk about important programs with people so enthused about what they do in helping people. And I really appreciate your enthusiasm that you obviously bring to helping parents and babies. I want to turn to Angelica, and I want to note for our audience the noteworthy distinction of being in City and State's 100, the Power 100 list for Western New York. That's something. That's great. So congratulations. And I want to have you focus on some specifics that your agency provides. But in doing my background work, it's just stunning how many programs you operate: elderly, scholarship, developmental disabilities, just a very large. You have a development corp. It's so. Could you talk to us about that?
Yeah, we own a radio station.
Wow.
So the first Latino radio station, 24 hours, 7 days a week outside of New York City. So, a good way to think about Ibero. So Ibero was birthed out of the needs of the Latino community. It really started after the 60s riots, when other organizations like ABC and Urban League were birthed to address the needs of our community. Ibero does have a very diverse portfolio, and it's mainly because we find ourselves standing in the gap of a lot of the services needs in our community. So that's how you end up with 80 something different things in a program portfolio. But Ibero's primary role is really, the empowerment, the uplifting, the advancement of the Latino community, ensuring that they have access to the services and the resources that they need. But at our heart, we're truly an advocacy organization. And that is something that in the past 2 years, we were reminded of who we need to be in our community. Language access continues to be the largest barrier for the Latino community to provide services. And even when language access is present, we find that a large barrier is having culturally responsive programs where Latino families, when they come in, they feel welcome, they feel received, and not stigmatized by the services that they're trying to seek. So yeah, we've opened up a charter school, if you didn't know that, is now a separate entity. We were the original creators of the Puerto Rican Festival, which is the longest standing Latino festival in New York State. So Ibero has birthed some very great things in our community that are still standing today. So it's a very exciting organization. There's not many Latinos that don't know about Ibero or have been influenced by Ibero. I was a recipient of Ibero services. I myself am an Ibero story, so we have quite a bit of a role here in the Latino community. And as you can see, we just recently merged with an organization in the capital region, Centro Cívico, and we're really excited about taking some of the influence and abilities that we've been able to do in Monroe County and really empower those smaller Latino communities that are living in smaller cities like Amsterdam and Albany that may not, have the resources that Rochester has.
Thank you. I want to get back later to the radio station because I find that fascinating. My friend Luis Miranda at the Hispanic Federation has long schooled me in the fact that Latino American families tune in as family to media much more than other communities, and so they rely very much on their newspaper, their local newspaper, their radio stations, in the bigger markets, television stations there. So I find that fascinating. We'll get back to that, all right? Because I want to bring Carla in for a little more discussion of social determinants. Last week, in our Long Island event, Anna Almanzar was joined by Dennis Johnson, who is our foundation's managing director of strategy. And it was interesting because he's a scholar on social determinants, and he lets everyone know 80% of health outcomes are not, in fact, directly impacted by direct medical care. 80% are the social determinants. And I wanted you on today, Carla, because I just find it unique that most people would not think of legal services as tied to social determinants of health. So can you give us a little in-depth discussion of that?
Yeah, it can also give you a little piece of legal aid history. When the foundation grant was first identified, we thought, this isn't going to fit. But then I looked at it a little bit more deeply and I said, this is going to fit, because legal services is really the tool that runs through all the basic needs that people have. And those basic needs impact on their health outcomes greatly. Like taking a look at education. Kids that come from poverty don't have the same abilities. They don't have the same supports. They may not complete their education. They may not get what they need. And if they don't do that, that's going to greatly impact on their ability in the future as in the community and their ability to live healthy lives. Immigration, that's the other program that the foundation is funding. Very clear link between getting a person's citizenship, getting a person's status, and helping them ensure that they have healthy outcomes, health care outcomes that are appropriate. But take it beyond that. When you look at housing work, housing greatly impacts on a person's the social determinants of their health. If their housing is unsafe, if they're homeless, if they're about to become homeless, that impacts on it weaves its way. I guess it's, to me, legal services provides families with the tools that they need, the intervention that they need to ensure that their basic necessities are met, and that is all intertwined with what are healthcare outcomes, healthy outcomes for our community. I see it every day in the impact that we have when we help our clients obtain the relief that they need in court, that then just positively impacts every other aspect of their lives. And folks that don't have resources to hire an attorney, if not for places like the Legal Aid Society and the other legal services providers, might not have counsel to assist them. So in many, many, many of the civil cases that are out there, there is no right to counsel like there is in criminal court cases. And so the advocacy that we provide, the intervention that we provide, links all those little pieces together and helps provide a good outcome for the families that we represent.
Yeah, I've been very happy to see the state's court system really push more attorneys that are in private practice to help provide pro bono services for those in need. I always admire, I think the entire legal community really admires the work of Legal Aid Society and those that are, in the trenches, so to speak, and not out of a desire for financial gain, but rather the real point is justice, and justice for people that otherwise can't get a true sense of justice because they can't afford it. So I thank you for that work.
Thank you.
I had another tie that I thought of with a current event, let's call it, tied to social determinants of health. And I'm going to ask that we have a polling question that I had prepared. We'll pull up a polling question for our audience, and we'll talk about the results a little later on. We'll let the polling question stay open for a couple of minutes, but you'll see that because Rochester is so much in the news and it's so much part of the community discussion of violent crime in the community, and people and kids having to grow up in cycles of violence. And I thought it would be interesting to get the community's reaction to the link of social determinants of health to violent crime. So outside of just a simple question of criminal justice or, criminal statutes and prosecution, outside of that, what should be addressed? What is the highlighted items that should be addressed to help curb the patterns of violence in our cities? And this focuses on Rochester for this event, but I think it'll better inform us of what the community's reaction is. So we'll just let the audience answer those. Panelists, I think you can do that as well, and just pick, it's multiple choice, but just pick one or two so that we can evaluate the results and discuss that amongst our panelists in a few minutes. So Sharita, I was wondering, when you have the nickname of the baby lady, how many kids' lives do you estimate that you have impacted in your career? How many babies then, lives have you helped out in your work?
Wow, that is a question no one has ever asked me, and I don't begin to know the number. I can tell you that Healthy Baby Network serves between 300 and 350 families a year, and I've been here for 24 years. I can also tell you that I have never, ever passed a baby that I could not stop and greet. And I just believe that babies are one of our most precious gifts, that you greet them with lots of love when you see them, and that you say kind things that help them to grow and be nurtured to them and to their parents. And so I do that in my personal life when I'm in the store. I do it professionally. I love when there are babies in our office. So I would say thousands, right? But I will also tell you that one of the most inspiring and sad things that has ever happened to me, and it actually launched our outreach effort, was that I was in a local grocery store and there was a young woman who was pregnant, and I went over to congratulate her, and she burst into tears. And she said that I was the first person that had ever looked at her pregnancy and said anything to her positive about it. And my heart broke for her, because I certainly understood the concerns that might make people say things that would be perceived harsh, and probably some harsh things to her. But I also wanted her to know what a special moment in time this was, and to congratulate her. So I gave her my business card, and I helped her coordinate some other services, because she did go on to call me, and I did work with her. But one of the things that we really identified as a need in our community, that was a gap in our own agency, was the ability to reach out and just connect moms to services. And so that was how our outreach program was born. And one of the things that I love about talking about the social determinants of health is that we get to talk about how complicated life is for many of our parents in this community, and how often those complications have complications that play out and some common themes, but very differently for each of these families. And so what we really need, and what has worked well, I'm happy to say that we have done partnership work with both of the other organizations represented in the care and support of providing services to mothers and fathers for the best interest of their children. And so, we added fatherhood services. We have a fatherhood program now that provides the kind of services that our community has been well known for providing to moms directly to dads. And that has been a game changer as we've really focused to really center in and focus on vulnerable families. And so, and I'll just say briefly, our doula work. Doulas are an evidence-based intervention towards structural racism and bias in our medical care that plays out differently for Black women. And so when we look at the escalating rates of Black maternal mortality and morbidity, those deaths and those near misses for mothers and for babies, getting doulas engaged early in pregnancy and providing care at birth and into postpartum is an intervention that we've been able to expand across our community by training women from our community to become doulas, and working to then embed those doulas within our medical practices as part of the care teams.
That's great. I love stories like yours about the pregnant mom. I mean, it's heartbreaking, but the fact that just on a one-on-one basis, you were able to have an impact, not just on her emotionally, but then on a healthy outcome, is just a great story. I think most people in the provider community have those moments that reaffirms, oh, why I am doing this. This is exactly why I'm doing this, and that's a great one. Thanks for that. Why don't we take our poll down now, and I'll ask for the results in a few minutes, and then we'll talk results. But I said I wanted to get back to that radio station. So Angelica, you have to tell me, do you use the radio station to do promotion of the services that have the impact on the social determinants?
Yes, let me tell you, the radio station is one of the most powerful tools that we have, and that became really evident during COVID. So I just want to go back to something you said about families gathering around news and media. So that became a huge barrier for us in Rochester, because when the pandemic was happening, families were gathering around national news and media, which can be very different in the needs that we have locally. So people were getting their COVID numbers, their COVID information from channels like Telemundo and Wepa, and they knew everything that was happening in the island and every other Latin American country, but they weren't always aware of what was happening in their own backyard. So the radio station really becomes a way for us to get information out to the community, have community discussions. Our radio station is truly a community radio station. We have health talk shows. We currently right now run a weekly health talk shows where the community comes together. People from the community come and talk about important topics, and not just promote the services that Ibero provides, but promote the services that everyone provides, right? Because it's really important that our community know what resources are available to them. Is our water cooler. I mean, 97.1 is really the Latino community's water cooler, where we gather and when we have those discussions. We just recently got a phone in our radio station because we have such a high request. People wanted to call. And it's been really interesting just having that, just people calling us and telling us what they need and what they want us to talk about and the issues that are important to them. So yeah, the social determinants of health, Ibero has always been rooted. We actually, I was just joking with my executive vice president. We're in this we call it the long game of neighborhood development. And it requires this tenacity, right? And this long vision when you're transforming neighborhoods who are plagued with, bad outcomes, but are also very rich in their community assets and resources. And one of the things that Ibero has been able to do in the Latino community, especially those neighborhoods that we focus on, is to bring those community assets out and really help our community leverage those assets that are in place to transform their neighborhoods and therefore transform their lives and transform generations. Adverse community experiences, when I think of violence, when I think of social determinants of health, the North Clinton corridor, where a lot of the work that Ibero has done lives, is, they call it ground zero for the opiate epidemic. We have more overdoses in one block than the entire city does. Total, kids are growing up there, families are growing up there, the elder are aging there. So when we come in with services and social determinants of health, we're really saying beyond programs and services, a place that you walk into. We want to be in your neighborhood, transforming your neighborhood. I don't know how many of you guys have been blessed to visit the International Plaza. But that lot was where over, thousands of people died in that lot of overdose over the years. And in partnership with the city, we took control of that lot. And now we're having health fairs, we're having community activities, we're giving vaccine access, we're providing education. So it's really elevating those assets within the neighborhood, within our own communities, because we always talk about it in the negative way, but we don't talk about all the positive things that we have that we need to leverage to really uplift our communities. And I think that's how we're going to have the greatest impact. So Poder allows us to take that work from a neighborhood and scale it to the larger community who may be in other areas. We know that the Latino community specifically here has changed dramatically when we took in over 8,000 people from Hurricane Maria. So they're not all living in the Northeast side anymore. So Poder has allowed us to take that work and spread it with a bigger microphone across our community. So we're very lucky to have that.
Yeah, that's great. As you said, it would really be wonderful to spread the idea of media expansion into smaller communities where there are significant Latino communities, but they just don't have the size that you would think necessary to begin a media market. But I think it's great. It's good to hear that the station is thriving. Carla, we just heard impact of COVID and from a community media perspective, but I've been wondering, because legal services are so often personal, almost like a doctor visit, personal. People are telling you of their most difficult moments with personal information, face to face. How has access been impacted for community members who have legal service needs and come to the Legal Aid Society? How has COVID impacted their accessibility?
So at the height of the pandemic, we remained open. We continued to provide services, but we were very careful about, we closed down walk-in, right? Walk-in intake, walk-in access to us. And ultimately, when it got really bad, we moved everything remote, including our reception, so that people could access us over the phone. I think probably the most vulnerable of the populations was our domestic violence victims. And what we did was created a helpline that gets you immediate access to an attorney who could counsel you. The problem was that so many people that were victims of domestic violence were sheltering in place with their abusers. And so therefore they could only get out when they could only call when they could. They were uncomfortable leaving the house to go to court. It was very complicated as to whether courts were opened or courts weren't open, what cases were being held virtually, what cases were being held remotely. But we remained available to clients and just became a much more virtual setting for our clients to reach us, for us to reach out through phone, through video chats, and then as necessary in person. We said we closed our doors, but we didn't close our services. And in fact, last year, we normally represent about 8,000 to 9,000 people a year. Last year, we represented 6,000. And that's with all of our divorce. They put all the divorces on hold at court. So no divorce cases were being processed. None of what they were considering non-emergency family court cases were being processed. They were only processing the emergency cases. There's been in place a housing moratorium that's come on, come off, an eviction moratorium. It's been, then it was lifted, then it was reinstated. That didn't actually stop the eviction work because evictions were being filed. Self-help was happening. There were illegal lockouts. So our staff was very busy doing that. So we had to make sure that we stayed in contact with our community. So we just used different methodology. We became a lot better with our Facebook group and our social media, creating videos and live streaming, community trainings in our immigration program, and just made sure that our clients or potential clients knew they could reach us and we could reach out to them. In this time, we were also finally finished our online intake process. So our intake has been telephone intake up till now. We've now added an online intake, which just gives people even more access and even more ability to, when they get a moment, they can do the application and then we'll follow up with them. The work that we do is very individualized to each person. It's all confidential. It's all highly specialized because, my situation is going to be different than the next person's situation. But we also maintain our presence in the community by making sure that people know what we do, doing community trainings, doing outreach, working with agencies like Ibero, like Healthy Babies, like other agencies to make sure people know that we're here and know what we do. I don't know, Angelica, if you know this, when I first got to legal aid, one of my first assignments, so to speak, was to create a link between legal aid and the Latino community. So I did work right at Ibero. I was located there 2 days a week and did my intake there and represented clients there. We've always had a very strong connection. But yeah, I think you're right. I think that the pandemic put a layer of challenge that none of us had ever really anticipated, but I think we met it, we met it as best we could. And I feel like our clients were able to continue to reach us.
Yeah, good, good. After we pull the poll up, the answers to the polling, which I'll ask for at this point, I think it's going to be telling because okay, so the number one response is helping to break cycles of multi-generational poverty, and followed, closely by collaborative relationship between communities and civil authorities, and then we have improved educational opportunities. Sharita, I can't help but think that it must weigh on you heavily at times that you're so involved in healthy birth outcomes, knowing that the challenges ahead for those babies are going to be, in some cases, enormous challenges. And does the poll outcome, the answers, surprise you in any way?
No, they don't. And I am, it's sobering is the word that I will use, because I think that in the course of our work, these are things that we work to address and things that we're very aware of. And so we talk about, often what are the life trajectories of the babies that we're serving beyond our scope of service. And one of the things that we work really hard to do is to ensure that the supports that we raise around families are continued throughout the life of that child. I say often either Pollyannic enough. I've been called a little bit of a Pollyanna. Or hopeful, I like to say hopeful, to believe that really when we engage all of the supports around families to be focused in on the health and success of that family and those children in particular, that we change the trajectory. Because once everyone's eyes and fingers and hearts are pointed towards a child, I believe that that's a relationship that only grows and expands as that child grows and expands. So I think that, we have many of the things active within our community that we need to heal our community, but I think we need to continue really honest conversations and tough conversations that have started around some of our social determinants of health, the role of race, ethnicity, and racism in our agencies and in our structures and in our systems. And I think that that calls for us to center on our families in a way that we, some of us are very well versed at doing it because we've been doing it for a long time, others not so much. But in the course of the work that needs to happen, it requires all of us to center right in on what's happening to our families, what are the barriers, how are these barriers landing, and then how do we evoke the right supports that really get at things like understanding not only the cycle of multi-generational poverty, but the psychology of multi-generational poverty, and how what we believe and what we think and what we have access to, and then how we utilize those things also contribute to what can become a cycle of multi-generational poverty. So, I'll offer that. I see Angelica shaking. I know that there's a lot that she wants to say. So I'm gonna look over and let you go ahead and jump in.
Angelica, comments?
No, I'm not surprised either. I think, we want to create change that is going to impact beyond us. One of the things that I learned as a newer CEO at Ibero in the pandemic was that we really need to be building programs that are working two generations at once, that are really having deep generational changes. And that's why our our neighborhood work really becomes important too, because, you know, making sure home ownership is a real option for people, that education, you know, workforce development. And I know that people need access to resources to do that. But I'm not surprised. You know, I grew up in the northeast side of the city. You know, I know I face a lot of these challenges myself personally, and I'm also, you know, very keenly aware of the systemic downfalls that we have. But that's the change that we need to create. And I love that you said the psychological aspect, you know, because, you know, there's a term that we use here in Iberia about adverse community experiences. We experience trauma together as a community, not only just at the individual level, but we experience and we've experienced it a lot this past year, of community trauma that is deeply rooted on systemic racial issues and generational poverty. You know, it's all tied. So I love, Sharita, that you said about the psychological perspective, because we have to heal ourselves while we build, you know, a new future for ourselves. So I'm not surprised that that's what people are looking for.
Yeah, I'm not surprised either, based on a career in the nonprofit sector myself. But I have a specific question about one of them for Carla. Even though it got the smallest percentage of response, I could have done an entire poll on housing.
Yeah.
And I want to ask you, how are you getting ready for what is going to be a tidal wave of evictions and with people to, you know, for people that have limited housing options?
Well, so that's a really good question, because it really is sticking a finger in a hole that finger is going to come out, and it's going to be kind of overwhelming, I think, the numbers of evictions that will come. Although I will say that the recent moratorium that brings the eviction moratorium to January 15th of 2022 does have some provisos in there to allow landlords to challenge the request for a stay of the eviction. It requires some proof that in fact a person has been impacted by COVID, and that so it's not a given, and it is already work that we're doing. But you know, we are blessed in this community because we do have resources, and we do collaborate and cooperate together. So Legal Aid is part of a bigger collaborative called the Tenant Defense Project. That was a dream of ours, and then when I say ours, I mean the Legal Aid Society, Law New York, Just Cause, and Empire Justice Center, the 4 legal service providers. It was a dream of ours to create essentially a universal access to counsel, a right to counsel in this community. It isn't a rights counsel, but it's funding that will allow us to represent everyone who wants an attorney that's facing an eviction, for sure in the city of Rochester. Since the executive orders expired, the court, there was I don't want to get too technical, but there was a court created that brought all the town court evictions into the county court, into downtown, so that we could cover those also. That's expired. So now the town court evictions are all back out in the towns. And, you know, that's a huge other issue to grapple with. But so for now, we have gotten funding to bring staff aboard to get prepared and to begin to help folks out that need assistance to prevent immediate eviction and to prevent their homelessness. Part of what we do at Legal Aid, and part of what I've always thought was important, is that we look to have a long-term impact on the work that we're doing. We look to have a long-term impact on our clients so that we make sure that if in fact somebody owes their rent and, can't pay it and needs to move, that it's done in a way that is structured so that they have a place to go, so that they have what they need to, to get there. In our domestic violence program, we make sure that the order of protection we got, somebody actually had an impact and they're safe. We do follow-up calls. We look at the longer term impact to start to get at that strengthening of families, that breaking those cycles again. But in housing, I would say that for as much as we know that there's going to be a little bit of a tsunami of cases coming forward, there are also resources to address them. And there's also resources for clients to access, funds for them to be able to draw down on from the city, from the county, from, I think, other agencies that have funds to help cover the costs of their rents, and to help cover the costs of their rents if an eviction is filed. So it's really important for people to not, throw their hands up and say, I don't know what I can do. That they should contact people like the agencies here, like Legal Aid, Just Cause, or what have you, and we will get people connected to the proper services.
Thanks. Thanks. I note that we are coming to the end of our time. We do have an audience question. I'm not seeing the question, though. It indicates that it's a question for Angelica and Sharita, but I'm not seeing the question. Can our questioner maybe contact offline Angelica and Sharita? Oh, there's the question. How can we collaborate to spread the essential resources to urban communities? That's a critical question. I think we don't have time to fully explore that at this point. I will say, though, that our three panelists today certainly are experts in answering that question. So maybe contact offline and talk more. We encourage that always among the nonprofit community. Anyway, I want to say thanks very much to our audience for joining us today. The spirit of Mother Cabrini is alive and well. It's evident. One of my favorite philosophers, the musician Carlos Santana, tells us that we should conduct ourselves every day in a way that brings blessings and miracle opportunities to people's lives. And I really think that notion is in the three panelists today's hearts. It's very clear how much you care about the community and how you act to allow people to receive blessings and miracles. So I really want to thank the three of you, and I hope we speak again soon. Thanks very much.
Thank you very much for having us. This was great. Thank you. Thank you, everybody.
Thank you, everyone.
All right. Bye-bye.
Bye-bye.